I would say it really started in high school, junior high and high school, to be honest. I had a couple of friends who went through some really tough times, and as a peer, I really didn't have the skills or the abilities to help them in the way that I wished that I could, and got me interested in the helping fields. So then, pretty much from college, I knew that's what I wanted to do, and I graduated, went to grad school for social work as well, and I've been doing casework since I came into the profession. My first casework job was as a prevention social worker, going into the field and helping kids prevent them from being placed. And then about a year later, I came to Parsons. Been here heading on 9 years now. And that position was a social worker for the Wasson Residential Treatment Center. So that was really getting into it. I did that for 5 years. And then I came into a foster care position with family foster care, and then became a supervisor of a different foster care program called Multidimensional Treatment Foster Care. And then I came to this position as the B2H HCI supervisor. It's definitely a community-based program where you're going out to the families' homes and meeting with them there, working in their environment and in their homes. All of the programs I've been in involve that, so I think that's where they've all been driven by casework. But this position just feels more of that because it's more the tangible services as opposed to trying to do more talk therapy. In my role as a supervisor, it is a little more of a step back from the direct casework. So if I'm not meeting my own clients on a given day, I'm checking my messages to see what's going on with my staff. My staff directly are healthcare integrators, and they are the ones going out into the field, and they're doing exactly that. They're coordinating the services for the Bridges to Health program, so they're making sure that that the workers that are providing the hard services are that their schedule meets the family's needs, that they're actually going out and doing the work as they're expected to, that we're adjusting to any changes in the family's or the child's circumstances. For example, if a child starts to develop a school issue, that the waiver providers can support that and address those needs that might not have been there a month ago. I would say there's two things that I find most challenging, and one would be that we do work within a system, and there are times where we can't get things done for the families as quickly as we'd like to, or we may not have the resources, or we may have other limitations that we have to accept and sometimes struggle with to find a different solution. So that would be one of the biggest challenges. Another would be also accepting that families take time to change. The change can be small and slow, and that's just the pace that the families need, and that's okay. And it's also not a reflection on the work that we're doing. It's the nature of change. The families, of course, can be challenging, and they may not be on the same page that I may be on, but I think for the most part, however the families got to where they're at, that's not what their ambition was. They want good things for their children, they want to succeed, they just may not know how to do that, and they may not know how to get out of the pattern that they got into. One of the rewards is bearing witness to the struggles that the family have gone through, and what they've persevered through. When a family comes to you, or when you come to a family, wherever they're at now, they've already tackled numerous challenges and often have always persevered through them. They've gotten through somehow. And I think that when you work with a family and see where things are going right, bearing witness to that is very rewarding. And if you can maintain that you know that change is going to happen slowly, then any improvements that a family make is very rewarding. Sometimes just knowing that you're a support and having a family come to trust you and get to a point where they do value your input is rewarding, and knowing that it might be years from now before the benefit surfaces, but that it will come and it is there.